7 warning signs of a heart attack. Today, we will be discussing heart attack symptoms, 7 warning signs you should never ignore. Each year, 735,000 Americans have heart attacks. And worldwide, 7 million people die from heart attacks each year. Heart disease is the #1 killer in the US, and yes, chest pain is a common symptom, but it is not the only symptom of a heart attack, and sometimes it is not even present. Women in particular tend to have more subtle symptoms, which can easily be overlooked. Time is muscle. So let's get started. 7 warning signs you should never ignore of heart attacks. Keep watching. And if you have not done so already, please subscribe to my channel and hit that notification button so you when I'm doing sessions. A heart attack occurs when the blood flow or the supply of oxygen to a coronary artery is blocked or stopped. When this happens, you no longer have the proper oxygen for the heart tissue, that heart tissue dies, and you have a myocardial infarction or a heart attack. When you get a myocardial infarction, it usually occurs due to fatty deposits or atherosclerotic plaques in the coronary arteries. It can also occur when there is a heart artery spasm, which blocks the blood supply, or if there is a dissection in that coronary artery. According to the American Heart Association, in the United States, 1 out of every 3 deaths is caused by heart disease and stroke. And if you have not done so already, please watch my YouTube video on stroke after you finish watching this video. So now, let's talk about the 7 warning signs of a heart attack you should never ignore. Number 1. Chest pain. Chest pain or chest discomfort is a very common symptom of heart attacks. People describe it as a crushing pain, feeling like an elephant is sitting on their chest or like something is just really weighing down on them. It can be in the center of the chest or it can be to the left of the chest. So chest pain is a common warning sign of a heart attack you don't want to ignore. Number 2, tingling or discomfort in other body parts. Even though we're talking about heart attack symptoms, the symptoms don't always present just in the heart. You can get symptoms in other body parts. So you can get tingling or numbness or discomfort or pain in the arms, either the left arm or both arms. You can also get tingling or discomfort pain in the jaw. You can get it in the back or in the stomach. So if you're having symptoms and even if they're not in the chest, make sure you don't ignore them. If it's something that does not go away in a few minutes and if it's a symptom that's not normal for you, pay attention because it could be a warning sign of a heart attack that you should not ignore. Question: how many of you have had symptoms other than chest pain that you later found out were warning signs of heart disease or heart attack? If this has happened to you or someone you know, please comment down below. Number 3, cold sweats or diaphoresis. If you are in a cold sweat, if you're having these beads of sweat on your forehead, you're feeling chills, especially if this is not something that's normal for you or if the weather does not indicate that you should have this type of reaction. Cold sweats can be a warning sign of a heart attack that you should not ignore. Number 4, nausea or even vomiting. Sometimes a heart attack symptom can present in the stomach area. You can literally become nauseated and start vomiting as a symptom of a heart attack. So nausea is the 4th warning sign of a heart attack you should never ignore. Number 5, shortness of breath. If you are all of a sudden becoming short of breath, much more so than the norm for you, then this shortness of breath is not necessarily your lungs, it's not necessarily being out of shape. Shortness of breath can be a symptom of a heart attack. Number 6, heart palpitations. Another warning sign or a symptom of a heart attack can be a racing heart or an irregular heartbeat. If you are all of a sudden experiencing an irregular heartbeat and your heart is just pounding, this could be a warning sign of a heart attack that you should not ignore. Number 7, dizziness or lightheadedness. If you are having a heart attack and you no longer have proper oxygenation to your heart, well then that heart may not be pumping properly to the body and you may not be getting proper oxygenation to your brain and you can develop dizziness or lightheadedness. So dizziness is the 7th warning sign of a heart attack you should never ignore. Question: how many of you, at least before watching this video, feel like you or a person who maybe would have experienced shortness of breath, nausea, symptoms that are atypical from chest pain? How many of you feel like you would have experienced these things yourself? If you feel like you are that person who may have ignored these symptoms, please comment down below. Or if you know someone who has ignored these symptoms and ended up having heart disease. Let's touch briefly on how to prevent a heart attack. First off, you definitely want to consult your primary care physician to find out your risk factors for heart disease and things you should be doing to prevent heart attacks. You want to do things like have a heart-smart diet. You want to exercise regularly, drink plenty of water. If you are a cigarette smoker, stop smoking cigarettes. And you want to make sure that you really pay attention to your body. Not everyone will get chest pain if they're having a heart attack. Women tend to have subtle symptoms. There are some women who only get fatigue or only get back pain or only get arm pain. And they could still be having a heart attack. Diabetics also tend to present in an atypical fashion. If you are a diabetic, you could have a silent heart attack or maybe just have a little nausea or a little jaw pain. And that could be your symptom for heart disease or a heart attack. SSO again, make sure that you are in close contact with your primary care physician or even your cardiologist to find out your risk factors and how to prevent heart disease. According to the American Heart Association, if you have hypertension, you can decrease your risk of heart disease and stroke by up to 50% if you lower your blood pressure. Be sure to watch my YouTube video on hypertension after you finish watching this video. I'll give you the link for it in the description. Remember, if you experience any of these symptoms or warning signs of a heart attack, please do not try to drive yourself to the ER. And loved ones, please don't try to drive the person having the symptoms to the ER. Go to the nearest hospital immediately without delay. There are professionals, medical professionals who can do life-saving procedures. Remember, it's all about living your healthiest, happiest life. I live by this checklist. It helps me every day and I hope it helps you too. And here you have it. These are heart attack symptoms. 7 warning signs you shouldn't ignore. Thanks for watching.